Today we are going to see about deviated nasal septum. Hi friends, I am Dr. Karamat. This is Scientific Doctor channel. In this channel every week medicine, health problem related videos are released. If you want to see such videos, subscribe to this channel. Also, do not forget to press the bell icon adjacent to the subscribe button. This week's video is about deviated nasal septum. In the nose, you have a septum in the midline, now which divides it into two nostrils. This septum is exactly in the midline only in 20 to 30% of the population. In the remaining 70%, there is some degree of deviation. So we have to understand if there is something which is present in the majority which is normal. So probably deviation is the norm. Okay, anyway, so mild degrees of deviation are not problematic, do not cause any significant health problems, though they can be left as such. Probably your doctor would have told you that you have a mild degree of deviation of your nasal septum. That's it. In moderate degrees, when you get respiratory infections, when you get a cold, your nasal block might be little severe than usual. In severe degrees, even without cold, you can have nasal blocks in one side or in both sides. If you have a septal deviation, now it is extremely pushed to one side, the other side now becomes roomy, the tissues there undergo hypertrophy, excessive growth, and thereby causing again nasal block. So even both of your nostrils might get easily blocked. You might have to adopt a open mouth breathing. You can have snoring or noisy breathing during sleep. You may have recurrent sinus related infections. You may have facial pain, whether it is related to the sinuses itself or whether it is related to the crooked nose itself is not very clear, but you might have facial pains. Because you are not able to breathe completely through one nostril, you might always prefer to adopt a specific posture, specific side during sleeping. So all these problems can happen in severe degree of nasal septal deviation. So how to go about treating this? In mild degrees, it is just you don't have any problems, you need not treat it. In moderate degrees, only during times of cold you might be given decongestants. Word of caution about decongestants, especially nasal decongestant, do not use them indiscriminately without doctor's advice, which itself can cause problems. So with doctor's advice, you can sporadically use these decongestants. And if you have a severe degree of septal deviation or if you have problems because of that, the definitive treatment is surgery called as septoplasty. This septoplasty may often be combined with rhinoplasty or nose job, where your nose externally also is crooked. So to correct that, you might undergo a rhinoseptoplasty. Otherwise, if your septum alone is deviated, you might undergo a septoplasty. So septoplasty is a surgery done by ENT surgeons. It also has its own inherent complication. So if you just have a mild degree of deviation, necessarily you need not undergo this septoplasty. Only in case of severe deviation and if you have problems with doctor's advice, you might undergo this septoplasty. Hopefully this video would have shed some light on deviated nasal septum. If you consider this video useful, please share it among your friends and relatives. If you want to see such videos, subscribe to this channel. Till we meet again, bye.